Now instead of the trickle-down economics that Republicans have been criticized for so many years, looks like we've got bubble-up poverty that is coming from the Affordable Care Act and its devastating effect on employers and employees across this country. Certainly something I hear about every time I go home to the 26th District in North Texas. In fact, 2 weeks ago, I was on a panel in Irving, Texas, with a variety of business owners, hospitals, insurance interests who were talking about the implementation of the coming implementation of parts of the Affordable Care Act. We've heard all along from the people who run the small shops, the restaurants, the franchisees, the difficulty that this onerous bill is going to place upon their shoulders. But I was hearing from people that I had not heard from before: car painters, metal shop fabricators, those people who have those shops at between 40 and 60 employees, those who are above 50 employees looking for ways to reduce their workforce, those below 50 employees understanding that they must never do so. The gentleman also brought up about the 49ers, the businesses that will not go above 49 employees. Well, there's also the 29ers, the employers that will not keep somebody on the payroll for longer than 29 hours, lest it triggers all of the other requirements of them under the Affordable Care Act. And then you've got the employers on the other side of the question, the large employers, who are looking at a cost of providing health insurance for their employees, which is steadily going up. In spite of the assurances of the President and the Secretary of Health and Human Services, those costs are going up every year. Well, they're looking at those costs that are rising. They're looking at the fine under the employer mandate. Some are doing some simple math and save a lot of money. I mean, a lot of money by simply moving my employees off of employer-sponsored insurance into the health exchanges. And that, as a consequence, would balloon the cost for the federal government for delivering on this legislation. We do hear a lot about the effect on the economy. The doctor was right to touch on the effects on the health profession itself. But there is virtually no aspect of American life that will be untouched by this legislation. Every man, woman, and child amongst us for the next 3 generations is going to be affected by, again, law which became law as a result of the worst type of process.